What are the different types of facelifts? Can you tell us more about that?
Sure, Laura. See, if, broadly you can divide facelift into a non-surgical and a surgical variety of facelift. So non-surgical would be things like putting fillers or doing thread lift. The problem with these non-surgical techniques are that they give a very subtle, short-lasting impact, and therefore they are probably appropriate only for people who are in their 20s or early 30s. Once you are beyond that age group, you have to take help of one of these surgical techniques. And the surgical facelifts are broadly divided into three different types. The first and more commonly offered is when a surgeon just pulls the skin back. The problem with that is that it gives you a very artificial, tight, stressed out appearance, which does not look natural, and most patients will not be satisfied with it.
Is that the type of facelift that most people are familiar with, would you say?
I would say so, because most of the offering clinicians are not well versed in the other variety of facelift. They tend to offer just a skin lift, which is quicker, and it can be done under local anesthesia, which means that you do not need to be put to sleep. But as I said, it gives a very artificial appearance, and the outcome does not last long. Which brings us to the second kind of facelift, which is also called as a smash lift. And that involves pulling the underlying tissue a little bit, which is a bit better than the skin variety of facelift. But again, it does not give you an optimum outcome because you have not mobilized the whole underlying muscle and the tissues and the ligament which have sagged. It can be applicable and probably useful for people who are in their 30s and someone who has a very subtle impact of aging and does not require or does not want an extensive surgery. The best variety or the best kind of facelift which would be applicable to most people who are above the age of 40 would be a deep plane facelift. And the deep plane facelift differs from the first two varieties in the sense that it addresses the underlying muscle and the ligaments in totality. These ligaments and the muscle are the main issues, main problem which sag with time and lead to the apparent aging of our faces. So the deep plane facelift, what it does is it goes under those muscles and takes care of these lax ligament so that we can completely reposition them back, elevate them back, and then fix it to the deeper tissue in an elevated position. And once you do that, the benefit is that you have done a natural lift, the results last for longer, and you do not have that artificial stressed out or pulled back skin appearance. So broadly speaking, these are the different varieties of facelift. And to put it in a nutshell, if you are in your early 20s or early 30s, perhaps you can get by without a surgical facelift. If you are in your 30s and if you want something subtle done, then you should go for the smash lift. But once you are beyond the age of 40 and you have significant changes of aging on your face, you will get the best outcome if you go for the deep, plain, comprehensive face and neck lift.
Okay, thank you. And when you look at the three together, because I think that's very interesting, is there a understanding, do you think, in terms of the clear names for each of them? Are they called different things, or are they always called smash and deep plane? Because I've been a little bit confused myself by how they're named online.
You're absolutely right. So if as a layperson, if you go on Google or any website and if you type the term facelift, you will be coming through a lot of pages which do not clearly distinguish between these different varieties. It can be very confusing because what is meant by a facelift on a particular website or by a particular surgeon can be completely different from what I have told you right now. And that's why it's very important that you do not rely on completely on the information that you read on the website. It is vital that you go and speak to the surgeon and specifically ask them whether they will be moving the comprehensive layer, which is called as mass, whether they will be dividing the ligament which suspend it and reposition it properly. If they are not going to do it, then it is not a comprehensive deep plane facelift. And if you are above the age of 40 or 45, you are not going to get the optimum outcome. So it is important that you do not get misguided by the lack of clear distinctions on internet and go and speak to your surgeon.
Hi, we've got something fun for you. We have a quiz below that will help you to understand whether deep plane facelift or other techniques surrounding the face might be right for you. So take a moment, have some fun, and take the quiz below.